So on more than one occasion, me and my coworkers have been exposed to patients with positive diagnosis of COVID-19 along with DKA. And in this video, I'm going to explain to you how to treat these patients in case you run across the same situation. So one of the telltale signs of a person who's suffering from DKA is Kussmaul's respiration. That's very rapid respirations, and they could also have polydipsia, polyuria, which is excessive thirst, excessive urination respectively, nausea, vomiting, and signs of inadequate ventilations like decreased SpO2, increased respiratory rate, cyanosis, and also along with some signs of dehydration. And these causes for this is, there's a couple. You have infections, intoxications, and sudden withdrawal of an insulin in some of these patients, and type 1 diabetics especially, but also type 2 diabetics could be suffering from this. And that leads us to one of the other causes, which is infection. And like mentioned before, the infection with the COVID-19 virus has been seen amongst me and my coworkers here in the 911 system in New York City. And just keep in mind that the patients that we receive do present with some, if not all, of the symptoms that I previously mentioned. Now, the treatment for these patients is you get on scene, you do your BVP, your personal protective equipment, you isolate yourself from bloodborne pathogens and respiratory pathogens, and after you down your N95 mask, your face mask, your shields, your face shield, and your PPE equipment, personal protective equipment, and you reach the patient's bedside, you want to get there after taking all the personal protective precautions. Then you want to get to the patient's side, and depending on how they present, depends on what you're going to do first. And so usually these patients will be in a nursing home setting or in the setting of a caretaker or someone that, not always, but someone that has taken their blood sugar. So if they haven't had their blood sugar taken, or if they have, take it anyway, because you want to confirm to see if it's gone up or at where it's at. Usually these patients with DKA, you have here, it says high. It won't even tell you a number. Like, it'll be so, the milligrams per deciliter are so high that it won't say 500, 700. It all depends on the specific model, but usually it'll come up as high. Okay, put the person on oxygen via non-rebreather or BVM, depending on how bad they're doing and how much accessory muscles usage they have, and also on their SpO2. One of the things I use as a gauge as to what I'm going to do with a patient, whether I'm going to intubate them and use an advanced life support procedure, or am I going to use a basic life support procedure, is I utilize the SpO2 as a gauge, and along with the accessory muscle usage and capillary refill, even in adult patients. So what I mean is, if I have a patient whose SpO2 is coming up at 75, 70 or below, let's say, and they're on 15 liters per minute on a non-rebreather, and it looks like they're going into respiratory failure, then that's a no-brainer. I'm going to pull out the intubation kit and go ahead and take over their airway. But if the person is showing signs of difficulty breathing, but their SpO2 is like between 90 to 95, let's say on 15 liters per minute, then in my that would not be interpreted as an indication to intubate. Another thing is, you want to do, after you confirm that this is high in adult patients and pediatric patients. I have not had a pediatric patient with DKA, but in adult patients, you treat them with a liter of normal saline or Ringer's lactate. And a little word about the IV access. I have a 22 gauge here on purpose. These patients are known to have bad vasculature, and the odds of getting a 18 gauge on them is slim. So if you need a 22 gauge, it's not ideal, but it's best to have a 22 gauge than no gauge. All right, so if you have no choice, use a 22 gauge. All right, give them some fluid, up to 1 liter on standing order. Online medical control, pediatric, on standing order, you have 20 mLs per kilogram, and in online medical control options, the repeat dose of 10 mLs per kilogram. Now, these patients also are known to have electrolyte imbalances, so it's always good to, this is not paramount, this will be first, But if you have time and the hospital's not too far, put them on EKG and check to see if they have any signs of hypo or hyperkalemia, because the DKA is known to cause electrolyte imbalances. All right, guys, that's about it for this. I hope it helps. Peace.